Women are here. We are here. We're concerned about things.
About 24 people marched through downtown Boise today with a shared goal: raise awareness around what they call a growing crisis in maternal health care. Good evening. I'm Shira Matsuzawa. Thank you for joining us here on the news at 10. And our Abby Davis was at today's march. Abby, this event was organized by a women's health advocacy group. Walk us through it.
Yeah, Shira, with the legislative session coming up, members of the group told me they want to make their voices heard.
Don't engage in hecklers, okay?
The cold didn't deter members of SW Idaho Now, an organization that promotes feminist ideals.
And we're gonna end up here at the end. We're gonna go down to 9th.
From marching several blocks through downtown Boise Friday afternoon.
We are here today to raise awareness about maternal mortality and getting some things back through the legislature that fell through last year.
A recent Idaho Kids Covered report shows the state's maternal mortality rate went up 121.5% from 2019 to 2021.
I imagine that the general population out there has no clue.
It also shows the infant mortality rate increased 18% during that time period. Idaho Now President Cindy Thorngren.
This is not the Idaho I grew up in.
Says something needs to change, and soon, including the fact that Idaho is the only state without a maternal mortality review committee because of a July sunset clause included in legislation.
And it's the only thing that tells us what happens when people get pregnant and have babies, and if mothers die within that following year. We don't know.
Thorngren says the group also wants lawmakers to reverse Idaho's near-total abortion ban and increase postpartum Medicaid coverage from 60 days to 1 year.
Our poor women are the women who are most affected by this because they can't afford to go out, go overstate, or maybe come to Boise in some cases to get the care that they need.
Thorngren says she's hopeful Friday's march brings awareness to the causes they're passionate about.
If we find something that's going on that we want to talk about, then we're going to come down and we're going to make people aware again.
We're doing what we can to let people know that we're here and we're fighting for them.
The legislative session starts in early January. Thorngren says they have a legislative committee that works with lawmakers on policies about women's health in Idaho. Shira.
All right, Abby, thank you.